This week's Ask Dr. Durie comes from a patient who wants to know about serum beta-2 microglobulin. So as many of you may know, this is a protein which is found in the blood, and increased levels are related to an increased amount of myeloma or staging of myeloma. The question is, what does it mean if this serum beta-2 microglobulin is increased, but all of the other testing is normal, if the disease appears to be in a remission? Well, this does happen occasionally, where the serum beta-2 microglobulin will suddenly jump up, and what this typically means is that there has been an infection of some type, usually a virus infection, which could be anything from the flu to maybe a herpes infection or something like that. And so typically, if the beta-2 microglobulin has gone up, it really is something incidental and does not mean that the myeloma has relapsed. However, occasionally, if the beta-2 microglobulin is just kind of creeping up over a period of months, and there does not appear to be any obvious infection or inflammation or injury of any type, it is important to keep in mind that occasionally this could reflect some underlying myeloma active, and particularly in the setting of maybe non-secretory myeloma where the IgG is not going up, or maybe where there's a plasmacytoma which is outside of the bone marrow. And so, although typically it's something not to be too concerned about, it is important to be alert. And if there is a question of possible active myeloma, testing such as a whole body PET CT scan or some other kind of imaging may be helpful just to clarify if there's something related to myeloma activity, some early relapse, or maybe that the beta-2 will indeed go back down over the coming months. So bottom line, usually means nothing, maybe an incidental virus infection, but just to be alert and make sure that there might not be something else more important going on.